Once you've assembled the Xerosguard, you're ready to familiarize your patient with the appliance. First, slide the tongue crib to the furthest point anterior, creating the shortest length of intraoral suction tube arms. This is easily adjusted intraorally by pushing the arms posteriorly. Now you're ready to insert into the patient's mouth. You may wish to consider placing some petroleum jelly or lip moisturizer on your patient's lips to maximize their comfort. Remind the patient to focus on breathing through their nose. Insert the Xerosguard in one piece. Run your finger along the commissure to ensure the retractor cradles your patient's lips. Now examine the suction arms and tongue crib. The suction arms should wrap around the distal of the terminal teeth, and the suction ports should sit on the retromolar pads. The tongue crib should encase the tongue. It's sometimes helpful to ask your patient to stick their tongue into the crib. If you've done this correctly, your patient should be able to comfortably bite down into maximum intercuspation. Ask your patient if they're biting on anything. If they're not, you have successfully inserted the Xerosguard. If not, adjust the posable suction tube arms until this is the case. Don't forget to check the suction tube ports again if you've modified the suction tube arm positioning. Once you've finished your procedure, remove the Xerosguard in one piece. Disconnect the Y adapter from the suction and attach it from the Xerosguard. You will retain this piece and sterilize it with your other equipment. Disassemble the intraoral component from the cheek retractor and dispose of it. Retain the cheek retractor component and sterilize it with your other equipment. You may wish to disassemble this piece for space considerations in your autoclave.